So hi, I'm Eric Loeb. I'm a data scientist here representing DataRobot. DataRobot is Gartner's lead in the category of automated machine learning. We have a customer testimonial from one of the largest private healthcare providers in the U.S., Steward Healthcare, and the executive director for information systems there talks about some of the use cases that they've been able to do. Great.
If we do 1% reduction in staffing, meaning that we staff to volume and not staff to average census, we actually are saving $2 million a year for 8 hospitals, and now we're 38. If we actually do 0.1 reduction in the patient's length of stay, $10 million in savings. So the ROI for us is we're already seeing that, and we're only getting better from it.
That's uncharted territory for healthcare. A lot of people use the buzzword of predictive analytics or machine learning, but we're actually doing it. We have a product that's out on the hospital's floors now, and we see it work. We took our historical data and we trended all of our data to find out when our peaks and valleys were. So we were overstaffing to our volume, and we needed to have a better way to staff to the peaks and valleys of our volume. DataRobot has the tools to allow us to manipulate the data to learn from it. Healthcare is failing. They're being reactive. We want to see how we're going to do next month and take proactive measures to plan for those bumps along the road, and I think machine learning is the way that we're going to do that. Not only do we can tell you that there's going to be 20 patients arriving through the ED tomorrow, we can tell you 20 on what type of patients. That's what we're shooting for. The smarter you get, the more you want. I never thought I'd be doing this 2 years ago, but now that I'm doing it, I can't believe that we weren't doing it sooner.
3 minutes.
Yeah, so we can bring up the slides. Again, that was the executive director for information systems for Steward Healthcare. There are hundreds of use cases in healthcare for machine learning, automated or not. So she described predicting patient volume, because you can save a lot of money by getting staffing right for patient volume. She mentioned some of the healthcare cost drivers there for the hospital. So readmittance also was brought up earlier. There are also payers. There are use cases for payers. There are use cases in biotech, in pharma, for logistics. So there are many ways in which you can use machine learning to predict future outcomes and cut your costs, improve your service, or increase your revenue. Next slide, please. So the problem with machine learning, as opposed to automated machine learning, is it's expensive. It requires data scientists. And we're horrible people. You don't want to hire a lot of us. we have coding skills. We know statistics, and we need to, because there are a lot of pitfalls when you're doing data science. Things you can get wrong, coding errors that can cause false models to be deployed. So you really just want that bottom. You really just want that domain knowledge. So next slide. Yeah. So with automated machine learning, now, you're able to turn your data scientists into adequate data scientists. Any given data scientist is going to fall short on some area of knowledge, won't know all the algorithms, may make coding errors. Your team of business analysts and data scientists will be able to provide you with improved service and better outcomes and reduce costs, as shown in these long lists of healthcare use cases for healthcare providers. These can be deployed. What Erin didn't mention in her video was when they were predicting the volume of patients, they had 1,500 models of specific shifts and days that they ended up deploying. Now, if you think about the amount of work that takes, when it's often months for an individual to develop a model, to have 1,500 models deployed, in use, and being updated as new data comes in, and managed and tracked. All of that is able to be done inside a DataRobot, and it creates a whole new system of possibilities for businesses.
Very nice. Thank you so much. Okay, judges.
Okay, so did you get that video off the internet, or did you contract for that?
That's one of our in-house videos.
Okay, because it looked like she had on a crossing guard vest, and I kept wanting to stop. Yeah.
It's part of the game topic.
The other thing, you talked about the 1,500 models in predictive analytics. Isn't it true that predictive analytics tells you what the next day or hour or time shift might look like as opposed to what it will look like?
Yes,
Because it
correct.
sounded like she was representing it as we know exactly what will happen tomorrow when she knows what will typically happen in a typical band of time during
That's right, but you're able to shave off, so if your prediction is the average that I've seen for this kind of thing, and so you're understaffed, right, because you're missing some drivers, like it's a full moon or something, the predictive models are able to get you closer to the actual volume so that you're staffing as many as you need, or you can staff less when you're predicting a valley. It's much better than just the average, but the previous algorithms that they were using.
Okay, and in full disclosure, you and I had a chance to talk earlier when we were waiting in line to get our microphones. The automated piece of the machine learning, it sounds like based on what you were saying is that really is what's driving the creation of your algorithms, which gives you back that time to do other data science time. Is that accurate?
Yeah, that's right. The automation is key to what we're providing here. So there's expert knowledge of what algorithms work for a problem, what things you have to do to the input data to make that algorithm work right, so that you avoid the pitfalls that are besetting on every side when you're doing data science, and produce best algorithms in statistically appropriate ways so you can trust those algorithms.
Well, and I don't want to hog all the time here, but one last, this is
He
really...
gave you more than he gave us, so go ahead.
Yeah, okay, yeah. So really a comment here. I want to commend you because many times when a predictive analytics vendor comes to me, they say, oh, all you got to do is figure out what questions you want to ask and we'll figure out what algorithm to write. And my words back to them are always, I don't want to have to figure out the questions. I want the system to tell me what questions I should be asking. It sounds like the way that you're talking about implementing this is that you're getting very close to that.
No, I'm sorry.
Okay.
You do have to figure out what questions to ask.
Okay, still have, disappointing then. Okay.
Dagger.
No, that's,
Yeah.
you have to know your business, and you have to
Okay.
know what predictions will help you.
Okay.
Data scientists can help you formulate those questions.
3 minutes.
What are some of the objective data you would use to differentiate yourself from another predictive analytic company? So the automated part, I don't think I understand.
Yeah.
Like what the ROI is on that.
So we're taking things that take months to build these models, and we're able to do them in the course of an hour meeting with our clients.
So does that make you much cheaper to an institution?
Yeah, that's right. You don't have to have the size of data science team, the amount of time that takes, the amount of time it takes to get to.
Can you quantify?
Yes, I have seen, again, hours versus months. I've seen personally, I've seen in our data tracking. We get better accuracy quite often, 10% savings here, 20% savings there. So both in accuracy and time to market, we get improvements there. And qualitatively it shifts the conversation, right? So as a data scientist plus the business analyst, we're talking about what's the meaning of these data fields, what are the questions we're trying to ask, what other data do we have to answer these questions. It's a much better focused conversation than, we got to code this thing, we got to make this work with that, and the hundreds of hours that it would normally take to respond to any good idea from the business analyst is a little bit inhibiting. So now, okay, I can just do that easily. It really helps us move forward fast.
So this may be more of an implementation issue, but how do you advise your clients to handle randomness? It may be typically a slow shift, but there's a bus crash, a plane goes down. People could die if they don't have some kind of a system for handling randomness.
Really, if there's absolutely no predicting these things, then they're going to have to do what they do now, which is pay overtime, bring people in. You're able to predict distribution. You're able to find the most likely amount of time. You're able to find the band in which it's going to, your volume of patients is going to reside in this next day or that shift. You can't control for random events.
One quick question, one quick answer.
Are you sure I have to come up with the questions?
You have to indicate what it is you're concerned about in the business.
Okay.
And then we have to sit down and talk about how to get at it.
Thank you.
All right, thank you, Eric.